Hi, everybody, and welcome to the live Monica Makes It Happen Facebook show 137. And this show is all about you. So I need your help right now. I want you to comment, ask a question down below. And my producer's on standby right now, and they're looking for these questions. And we're going to be asking a doctor right now about your vaccination questions. It's all about vaccinations right now. Which ones are most effective? What about those long-term side effects? How about the short-term side effects? Should I be taking it? What can I do after I take? I mean, there's so many questions, and I know all of you have them. We have a doctor from NYU here, Dr. Stephanie Sterling. Thank you for joining us tonight.
Thank you for having me.
I know you're really busy, so I know actually you probably have to go see patients in a few minutes, but while we have you here, can you tell us a little bit about yourself?
Sure. I'm the Section Chief of Infectious Disease at NYU Langone Health Brooklyn Hospital, and I'm a co-lead of our vaccine center here at NYU based in Brooklyn, and I'm also the hospital epidemiologist. So working a lot with COVID in many different aspects.
Yeah, and you get a lot of questions about the vaccine, and I know I have a million of them. The first one I want to ask you is the injection, is the virus part of the injection, or the vaccine an injection of the virus? Does that make sense?
Yeah, it's a very common question. At this time, none of the vaccines that we are using that have the emergency use authorization, none of them are live vaccines. So all of them only have a small piece of a message of the vaccine. So it is impossible for these vaccines to give anyone the virus that causes COVID.
Okay, I just want you to know, Joanne, we're going to probably ask her question later, so stay tuned. I just have a few questions that other viewers are asking. Pfizer, Moderna, which one is the best? The 2-shot, the 1-shot? Is there a difference?
So Pfizer and Moderna both have EUAs, and they are 2 shots. Pfizer 3 weeks apart, Moderna 4 weeks apart, and then there's also the 3rd shot, which has EUA, which is a Johnson & Johnson 1 shot. They honestly, there's little differences you can nitpick, but in the big picture, the 2 shots maybe are a little bit more efficacious at preventing infection. But the big thing is really, how can we prevent severe infection? How can we prevent hospitalization? How can we prevent death? And all 3 of those do absolutely amazing jobs. And it still looks like 100% prevention of death and hospitalization and severe COVID. So
take the shot is what you're saying. Take the shot. There's a lot of false reporting out there, and especially in our minority communities, there's a fear factor there. Ignore that. Take the shot.
I really think any shot you can get, you get at this time. There may be little differences to get parsed out in months to come, but there's no winner in the race between those 3 at this time.
Yeah. Oh my God. So many questions coming in. We're going to get to all of them. Okay. Why do some people experience side effects, COVID-19, and how long do these side effects last?
To COVID-19 or to the vaccine?
To the vaccine.
The vaccine. So side effects actually are a sign that your immune system's working. It's recognizing this injection, saying, and doing what we want. And so that's a good thing. Common side effects are soreness, just like flu, and tetanus. My arm hurt like tetanus. Other common side effects are aches and pains. My husband had that. A lot of times these side effects are gone within 48 hours, and that's the best thing.
I couldn't lift my arm. It felt heavy, and it felt, I had that. But then after that, it was nothing. Why is it that some people are still able to contract COVID-19, even though they've been fully vaccinated? This is a good question.
Yeah, so it's an excellent question, and it's not a sign that the vaccine didn't work. Nothing is 100%. Even within the trials, people still did get COVID, but the differences between people who were part of the vaccine arms and the placebo arms was really big. So people who get vaccinated, there's still a small amount that can get the infection. What a big difference is that someone who was vaccinated who gets infected, it really looks like it's a much more mild infection, and most of those people don't have to go to the hospital.
That's good to know. So it's not a waste of time or effort or anything else. Melissa, we just asked her a question. Can you believe that? We're reading your mind. And Raymond is going into our next segment, which is speed round. Okay, here we go. We're going to do a speed round of sorts where we ask you, is it okay if we can do these things? Is it safe too, is what we're calling it. Can we go to the movies?
Kind of, yes. Be safe. Definitely wear your mask, be safe. I think the biggest thing is sitting within your bubble. And with any public event, I think the biggest thing is queuing up to buy tickets and queuing up to buy concessions, because that's kind of the biggest place where you're in someone else's space.
Right. And again, the vaccination status, is it okay? So if you take the vaccine, is it okay to go to the movies?
If you take the vaccine, you have a much bigger level of protection, another layer of protection. So I would say it's much safer.
You get opening day, see a baseball game at the stadium.
It's outdoors, so that's great. Sit within your bubble. That's great. Don't interact with lots of other people. That's great. Again, the biggest window would kind of be the lining up to enter and concessions. And so hand hygiene and wearing your mask. But when you're in your small bubble, it's probably, and especially if you're all vaccinated, that's a great safe opportunity.
And I'm asking your question. Okay, traveling by subway or bus?
Wearing your mask and hand hygiene, it's safe.
Eat dinner with a group of 10 indoors.
Indoors. So CDC says if you're all vaccinated, that is really quite safe at this time. If you're not all vaccinated, keep doing the mask when you're not eating, I would say.
Okay, have a field day outdoors with 10 plus.
Man, outdoors is great at this period. Still try to be safe, wear a mask when doing activities. If everyone's vaccinated, another layer of protection, and you can start thinking about pulling those masks down.
And Raymond, if you're watching, travel by plane internationally or domestically?
That's trickier. I think if you're vaccinated, another layer of protection, but that's a lot of indoors and a lot of time around people that you don't have good sense of. So I think vaccination helps you feel more safe with that, but wear a mask and use your hand hygiene, definitely.
And Elle's here, my producer. What are people asking?
We are getting so many questions online for you, Dr. Sterling, so I'll just take as many as I can and send them over here. John says, after you get vaccinated for COVID-19, why do we still have to wear a mask and practice social distancing?
Great question, common question. The vaccines are not 100% protective. There's still a massive amount of our community that is not vaccinated yet. And there's a lot of different strains out there that we're not quite sure exactly how perfect or how well these vaccines work against. So the way I think about it, the vaccine is a really huge, important piece or tool in our toolbox, but it's not a magic shield. And so until we get many more people vaccinated, all of our communities, high levels, we're still going to have to be careful.
We had a question from Instagram earlier where Rose asked, should women who are pregnant or expecting or trying to get pregnant, should they take the vaccine? Is it safe for them?
It's definitely safe. It's a dead vaccine. When we talk about unsafe vaccines for pregnancy or during pregnancy or immunocompromised people, it's usually because it's a live vaccine. That's not the case with these vaccines. The CDC has come out, and also ACOG, which is a U.S. overarching body that makes recommendations, are saying that it's safe. Pregnant women are definitely more at risk for COVID and possibly from severe side effects. And so especially someone who's planning or thinking about getting pregnant, now is a perfect time to get vaccinated.
I have two more here from social, and then Monica, I think you're seeing a ton on social as well. One is from Jeanette that I think is a question a lot of people are asking. And the question from Jeanette Correa is, if vaccines are still experimental and they're fairly new and came together fairly quickly, how can we possibly determine long-term effects and whether or not they're significant or what the risk may be?
Great question. We don't have anything for long-term effects right now, right? So we've got the amazing altruistic people in our country who started up with the Pfizer with any of the phase 1 or phase 2 trials. They were vaccinated almost a year ago. So those trials are ongoing. And at this point, there's no big red flags about any adverse events at this time. So I think that is really reassuring. All these trials are going on for the phase 3, I can say, is going on for 2 years. So at this point, there's nothing. There really aren't vaccines that we've had for years and decades that have long-term effects. So that also is reassuring.
Thank you. And I'll ask one more, and then Monica, I think we have a ton, but a lot of people are asking Adana's question. And Adana said, how long after having COVID, let's say you had it just now, how long after having COVID can you get vaccinated?
No perfect answer for this. It's a window is what I've told my patients. So as soon as you're technically out of kind of quarantine period, so 2 weeks after you start getting sick is as quickly as you can get vaccinated. But you're going to have antibodies thanks to the infection, and hopefully you didn't have a severe infection. You're up and active and doing okay. Those antibodies, for the most part, we think stay at good levels for at least 3 months. So I really think that window is from 2 weeks after you start getting sick to 3 months after you start getting sick, anywhere between there.
Can I just say, I love our viewers. Our viewers are the best viewers in the entire world, especially on our Facebook page. And Rita Correa, you've asked such an interesting question. How long does a vaccine work in the body? Like, how long is it in there? And then do you need a booster coming, years to come?
Oh man, that's a multi-layered question. So first thing, how long does the actual injection stay in your body is very, very, very quick. So that probably that messenger RNA or Johnson & Johnson is inactivated adenovirus. Those are probably out of your system definitely within 72 hours. Number two, how long does that vaccine last? So hopefully a really long time. The vaccine, ideally, it generates proteins and your body responds to that with its immune system. We need the immune system to respond in two ways, make kind of short-term good immune response. And so that's really through B cells, and then more of a memory response, which is through T cells. We know that the initial response, which is really that B cell, is great and super robust. The question that all of these trials are ongoing in order to answer is how is that T cell and how is that really long-term response, so that if I get exposed a year from now, I'm still protected. That's the answer we don't have yet. And that's the answer that may or may not mean we might need to get a yearly booster, some sort of booster. We don't know yet.
Wow. Okay. We don't know yet. But Katina asked a really good question. She took the Pfizer first dose and she had a little pain and she has that long-term effect. How common is that?
That's not that common to have a long-term effect. So there probably was a great immune response there, and maybe there was some sort of bleeding and a little bit of maybe even a hematoma or some sort of inflammation. So trying an anti-inflammatory, maybe some warm compresses might help that get better.
Well, that's interesting. And Donna says, what about going to a wedding with 150 people? Can she do a wedding? After vaccination.
So indoor, outdoor would be something to factor in. The state it is, kind of what their numbers are looking on is another thing to factor in. So I think that everything we do these days takes risks. I think being vaccinated, you definitely have much more level of protection.
I saw a really interesting question from Monica, just piggybacking, no, I'm sorry, not from Monica, from Alan, piggybacking off one of the questions before was, why do some people experience more severe side effects from the second dose than they do from the first dose?
Yeah, that might be part of the immune system being primed. So the first dose, the immune system says, oh, we don't know what this is. Let's respond to it. And the second time you get it, it's the immune system is saying, whoa, wait a minute, we recognize this. It doesn't mean if you don't have more response the second time that you didn't get a vaccine or that your immune system's not responding. Just each body's different, each person is different. And so we do see some people have more responses the second time than the first. I didn't. My mom was convinced she got placebo because she said, I don't feel anything. Most people don't feel anything, but it's really varied.
That is such a good question. This is a good question too. Prince is asking about wearing a mask. Do we still have to wear a mask after we're vaccinated?
Yes, please. So there's different variants out in the city. We don't necessarily know if they are more infectious or if they cause more disease. For the most part, it looks like the vaccine helps you not get it and helps you not pass it to someone else. But that research is still ongoing. And so part of it is you want to make sure that you don't have infection that you're okay with, but that you don't pass on to someone else that maybe isn't vaccinated yet and maybe wouldn't be okay with that infection.
Talking about myths, Temis just said she's heard about women being infertile or sterile after the vaccine. That is a complete myth, right?
That is a myth. That got a lot of traction, but that is a complete myth.
Good. And what's the difference between all these three vaccines? You say that there isn't a really big difference that you know of yet because we don't have enough research. I mean, you are the research expert. So is there a real difference there?
The big thing I think is that all three of them really appear to be 100% protective against death from COVID. and really prevent hospitalization. The nitty-gritty part about actually preventing actual infection and maybe mild and moderate infection, the 2 messenger RNAs based on phase 3 clinical trial data look to be a little bit better. They're in the low 90s for prevention, and the Johnson & Johnson was a little bit lower.
And thank you, Che. That was Che's question. And Eve has one last question. We're going to wrap it up here. If you've had your first shot, but several people in your office tested positive, are you safe? Can you not get it? Or
so the first shot, a couple weeks after the first shot, does give you protection. That second shot helps boost your protection up, but definitely the research shows that with that first shot, once you're out of that 2-week window that your body needs to make the antibodies, there already is protection up and running.
And Lisa Ann really wants me to ask this question. Sorry, Lisa Ann, I'm going to ask it right now. If you've had COVID-19, Legionnaire's disease, why are there similar conditions there? She says she's experiencing similar conditions with Legionnaire's and COVID-19.
Great question. So that's going to be your immune response to it. So they both can cause pneumonia. They both can cause other things, and it really is your immune response and that inflammatory response to those infections.
Dr. Sterling and Leanne, thank you everybody who was asking fantastic questions. Ellen, Amanda, my producers, what a great show. I think we're going to do this again. Will you come back, Dr. Sterling, and help us out?
I'd love to come back and answer more questions.
Okay, great. I know you have to go see patients now. And thank you everybody for watching here on Facebook. And you know to watch us on Pix 11 News at 5, 6, and 10. We're always making it happen.